So today we have Andrea with us, and Andrea's a makeup artist. She's fabulous. So she's come to us today because she has some issues with hair loss, and what we're going to do today is we're going to look at how we're going to help her with sort of replacing the hair that she's lost in the past. So Andrea, if you don't mind, like, just introducing yourself and telling the audience a little bit about sort of the problems you've been having.
Yeah. So basically, I'm Andrea. I am a makeup artist, and 4 years ago I was diagnosed with breast cancer, and I went through chemotherapy. And although I was assured that my hair would grow back perfectly as it was before, it actually didn't. It did come back, but very thin and very, I wouldn't say bald in places, but very sort of thinning and patchy. And it just never recovered. So I've come to see Dr. Mariam to see if she can help me.
Mm-hmm. And so as I understand, Andrea has so far been using minoxidil, both the tablets and the solution on the hair. Now, the first thing is I recommend for Andrea to stop using the minoxidil, because what happens in minoxidil is that it's very good in a short-term period and it grows the hair. However, the hair will not be permanent. The hair will fall out once you stop using the minoxidil. That's not what we want. We want the hair to grow strong and to stay. So that's why I recommended for Andrea to stop the minoxidil and any other products she uses on the hair, because any products you use will interfere with this in the sense that it will get into the hair follicle, and then of course it carries chemicals into the hair follicle, so it will not be effective. So in order to make sure that the treatment is effective, we need the scalp to always be quite clean. So that means that, you know, using a good shampoo, and for that I always recommend Head and Shoulders, and to not use any products and do things that will help to stimulate the scalp. So like doing scalp massages once a week, using hair masks, which are good for the hair, and anything else that you know, she thinks, or you know, anyone going through the same problem, anything else that you find that is good for the hair, just focusing on doing, you know, helping the scalp and the hair, and also drinking lots of vitamin C. So vitamin C with orange juice, it helps with the collagen building process. So okay, so what we're going to do with Andrea, I recommend doing the plasma treatment. So plasma, or PRP, is basically when you take the blood, you spin the blood, and then you just have the plasma, which is basically the fluid in the blood, and then it carries with it some growth factors, some stem cells, and these all help to stimulate the follicle to grow. So to be honest with you, at the moment, it's the only treatment that works. I've already explained that she would need at least 3 sessions to see results, and then after that she can continue until when she feels that she needs to have a break maybe, and then can continue. So the sessions will be on a monthly basis, once every month, and then and then we'll go from there. Okay?
Brilliant. Sounds
so we're
amazing.
just going to take the blood, and then I'll show you guys what the plasma looks like. So now I've taken the blood and I've centrifuged it, and as you can see, it's a nice level of plasma, very dilute, which is great. However, I just noticed that the color is a bit too yellow, which is fine. It's nice and healthy. We just, based on my experience, we want the plasma to be a little bit more orangey. It just indicates that there's has a bit more nutritious value, so there's a lot more antioxidants in it. You know, as you know, beta carotene has an orangey color, so any antioxidants usually in the plasma indicate a bit more, you know, sort of antioxidants in the plasma. So that's what we would like. So I recommended that Andrea to start taking the best antioxidant to take is astaxanthin, very strong, really good. And so she will start to do that, and that will also help with the result of the treatment. So now I'm going to take the plasma, and then I'm going to start injecting it. So this is something that I do. Not many people do, but I find that, you know, doing a bit of massage as well afterwards helps to make sure that the plasma really gets distributed into the scalp. It helps to, you know, get the results quicker. And you've definitely come at the right time because, like I say, the hair's grown, but it's very thin. So this hair is not strong enough. It's gonna fall out. And this is why minoxidil doesn't work, because you can see that it grows the hair. You can see the roots. Do you see how thin they are? See how thin the roots are? So this hair will not last. It's not strong. So it will just break or it will fall out. Good, all done. You have to, you're sorry about your hair, you have to, you can sort it out later in the bathroom.